Well, good afternoon, and lovely to be speaking with you again. So I wanted to talk with you this afternoon and just let you know about a program we are currently providing in Queensland, New South Wales and Victoria that may be of interest to you. As was mentioned, I co-led the Australian Child to Adult Development Study, in which we followed up young people with intellectual disabilities for 18 years, and that included 63 young people with Prader-Willi syndrome, and we predominantly collected information about behaviour and mental health, but other aspects including family well-being as well. Now, one of the findings, among many, was that only 10% of the children and adolescents who had major behavioural problems received specialist mental health interventions. And so we have to think about, why is it that if folks have got serious behavioural problems, they're not getting expert input? And, we might think, for example, that if we set up a specialist clinic, for example, a Prader-Willi syndrome clinic, then that might be a way of getting the expertise to all those who need it. But that doesn't actually work very well. For example, we have a very expert clinic in Prader-Willi syndrome in New South Wales at the Prince Alfred Hospital that Georgina Loughlin has been talking to you about. But in fact, there's only ever been 85 people with Prader-Willi syndrome who have attended the clinic, and it's been going for some 15 to 20 years. And even now, at any one time, there are about 450 people with Prader-Willi syndrome. So even if you provide a specialist service, it seems that only 20% of those who might benefit from it come along. So the question is, why not? Well, we think there are multiple reasons why not. Parents of children with developmental disabilities are very pressed for time. They have many demands on their time. They may just not be able to put aside the time to attend clinics. They may not be able to afford to take the time off work to go. They may live remotely. They may not be aware of information because of poor literacy. There may be various language barriers, cultural barriers. And I think an important factor is just that many parents of children with developmental disabilities are so stressed that survival is the name of the game for them, and even help seeking, which might be useful for them, is too much of a step. And there are probably many other reasons. So the challenge then is, how do you get high quality information and high quality service out to the community? How do you get it to a larger proportion than 10 or 20% of those who need it? And so this is our challenge. We wanted to increase the number of parents and caregivers of children with disabilities who access programs. And by programs we mean evidence-based programs, and we want to increase the number of professionals who can deliver evidence-based programs. And if we can do that, we can enhance parental confidence and competence at a population level, so across the whole community, and reduce the prevalence of child emotional behavioural problems at a population level. So how can we do that? So we have been funded to apply the Stepping Stones Triple P system. Now Triple P, many of you will have heard of. It's the Positive Parenting Program. It's an extremely widely used program, parent training program for children who are typically developing. It's been widely used in Australia and in a number of other countries. It's been extensively researched. And Stepping Stones is a particular version of Triple P for parents of children who have developmental disabilities. And now it's a multi-level program which looks like this. It's got these 5 levels, and the inverted triangle shows that the model is that the more basic the level, the broader the population reach it's aiming to get to. And then you have more intensive levels as you go down the triangle, which are designed for fewer families. And of course, the cost of such programs is a very important consideration. So as you go down to the more intensive levels, they cost more, and if you've got a limited budget, then they need to be directed at those with the most intense problems. There was a trial of one of the levels in level 4 at the Children's Hospital Westmead in New South Wales, and this was delivered by teachers in school. So this is not delivered by mental health experts, it's delivered by teachers who are trained by the program to deliver it. And as you can see, if you just look at the bottom one, the total, these are all, the various lines are various types of behaviour problems as on this measure, but the total one you can see, the teachers reported a 25% decrease in these problems. The parents less so, but if we had provided the other levels that some parents prefer, then those gains would have been able to be added on. So we've been funded to roll this out in Queensland, New South Wales and Victoria, and to see what kind of a difference we can make to this as a community, to the community problem of behavioural emotional problems in children with developmental disabilities. And the program starts with a survey. It might be a bit hard for you to see there, but it's called the MySay survey. There's one for parents and one for professionals. It's a collaboration between Universities of Sydney, Monash and Queensland. And then the second phase is we are offering training to professionals to be trained in the program, and it's a wide range, for example, school teachers, community nurses, staff of community non-government organisations. And then we're going to provide the Stepping Stones program, free. And the training is free and the program is free for parents under this program. And that's because various materials are provided to parents which normally have to be paid for, but we've been funded by the National Health and Medical Research Council as part of this research project, and so we're giving them out for free. Now, the other interesting thing about it is that the Stepping Stones program was developed for children with developmental disabilities in general. So it has been, in the main, tried with, and all the research showing how effective it is has been tried with mixed groups of children with developmental disabilities due to all sorts of causes. But we all know that that various causes of developmental disability have quite specific behavioural characteristics. And this is what we call behaviour phenotypes, and we all been hearing, for the last 2 days about the various specific types of behaviour problems that are more common in Prader-Willi syndrome. Now, I think it's just important for a moment to remember that if your child has Prader-Willi syndrome and has behaviour problems, that doesn't mean that all their behaviour problems are part of the behaviour of the Prader-Willi phenotype. I generally say that the behaviour problems have 3 sources. They could be specific to Prader-Willi syndrome, they could be shared in common with other children with developmental disabilities, or they could be due to individual factors, the child's temperament that Scott Stiefel was talking about, or various kinds of life events, their particular family, their particular relationships, their particular life experiences. So what we've done is we've developed separate resources for 7 syndrome groups. Those are listed there, and as you can see, Prader-Willi syndrome is one of them. So the specific materials, you don't need to read this, but I'm just telling you that, showing you the types of materials. There's a tip sheet which is available to families, which describes the condition and describes some issues around behaviour. Then there's a tip sheet for the practitioners who are going to deliver the program, because not all the people who deliver the program are going to be familiar with Prader-Willi syndrome, but this is specially prepared, summarised material which we've designed to educate them on the essentials quickly. Now then, the Stepping Stones program has 25 strategies, and what we've done is we have gone through the strategies and modified them to be particularly Prader-Willi sensitive. For example, you know, if you want to encourage desirable behaviours, you provide rewards. But we have said that in regard to Prader-Willi syndrome, managing hyperphagia in children with Prader-Willi syndrome often involves a strict meal plan. This allows children with PWS to know exactly when and what they'll be eating throughout the day, minimising the disappointment from unmet expectations. You might recognise the influence of Janice Foster there, thank you very much. Therefore we've said providing food as a reward may create expectations about food which can lead to disappointment and temper outbursts. So if one wants to provide rewards for good behaviour for children with Prader-Willi syndrome, it's best not to use food as a kind of reward. Then another strategy is about setting up activity schedules. And we've said that this is particularly advantageous, we think, for children with PWS, because activity schedules can reduce outbursts, anxiety and repetitive questioning. Visual activity schedules can be used to help children understand what's happening throughout the day and what they'll be eating. And schedules are also good for helping children prepare for changes in routines and when transitioning between activities. So these are some of the specialised modifications to the general Stepping Stones program to assist when the parents receiving the program have a child with PWS. Just here's an example. Here's a boy with PWS, and he has temper outbursts. Mum noticed that these are worst when he's trying to get ready for school. And so this is an example where an activity schedule could be applied. And here is an example of what a visual activity schedule might look like. And this is in terms of managing hyperphagia and avoiding unrealistic expectations around food, and establishing very clear rules around food, such as clear meal plans can help to reduce the tantrums around food. How do you access this program? It's currently running in Queensland and Victoria. It's going to be available in New South Wales from July, and you just go onto that website and register your interest. Now, we have got some handout flyers. Lauren, who's working with me on this project, I really should say who's running this project. I'm working with her. Can you stand up for a moment, Lauren? Lauren will be there, and she's got some flyers for New South Wales and flyers for Victoria, so you can collect those as you go if you think that may be of interest to you. Thanks very much.